So the objective of our course is to go over the basics of Medicare Part A, Medicare Part B, and talk about how and when individuals can sign up for Original Medicare. This should be very familiar to all of you if you're already through the AHIP and your licensure training, but let's just go from the very basic and we'll get into some advanced concepts as we go. Medicare.gov, that is our go-to source for almost all information, right? It defines Medicare as health insurance for people age 65 or older. You may be eligible to get Medicare earlier if you have a disability, end-stage renal disease or ESRD, or ALS, which is also called Lou Gehrig's disease. More than 66 million people in the United States get their health coverage from Medicare. So Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It is individual health insurance, and it is funded in part by the taxes you pay while working. And really, for me, this slide begins some of the confusion that our clients are going to encounter and that we as agents are going to help them uncover and get through. Think about it. For most people, their entire working life, they got their health insurance through an employer. Or maybe they had their own business, so they were self-insured, but still they got some type of a group policy. Maybe I was a stay-at-home mom, one of the most important jobs there is, and I was raising children, and I got my health insurance through a spouse. So all through my working years, all through my under 65 years, my insurance was not necessarily, it could be, but in many cases, it wasn't individual health insurance. It was through a group or through my spouse. It could be through an employer. And now when I get into Medicare at age 65, all of a sudden, it's all about me as an individual. I can have a different plan than my spouse, if that's how I've always had it. I could be going to Medicare potentially, and my spouse could be remaining on an employer group plan. So that one piece right out of the gate creates confusion because it's new. And we all know how well people as a general rule adapt to change. Not very well. That's why there's countless books and training programs on change management. This is one of the things that you're going to have to be able to explain to people in a meeting is that Medicare is for individuals. It's based on you, and you're going to pick what's appropriate for you. And it might be the case that you have a different plan than your family. It might be the case that you have a different plan than your spouse, and that's okay. Because that's how Medicare is set up, individual health insurance. Let's talk about eligibility for a minute. Who is eligible for Medicare? The most common situation that all of you are looking for and encountering in your weekly business is those people that are aging in at 65. So if you are 65 or older, and you as an individual or your spouse worked and paid Social Security taxes for at least 40 quarters, which is 10 years, right? There's 4 quarters in a year times 10. Simple math here, 40 quarters of Social Security. At age 65, you are eligible for Medicare. Some individuals under age 65 also qualify for Medicare if they have certain qualifying disabilities. And there's a whole list of what those qualifying disabilities are on Medicare.gov. In interest of time today, we're not going to go over every single detail for every single aspect of Medicare basics, but we will call out those opportunities to find more information on Medicare.gov. That's where you can find that list of qualifying disabilities. You can also be any age if you have a diagnosis of end-stage renal disease or ALS. Now, contrary to social media and hyperbole, you also have to be a legal resident of the United States. You have to live in the United States. And that has to happen for 5 consecutive years, including the 5 years just before applying for Medicare. So I have to be here for 5 years before applying for Medicare. That means if I move here when I'm 64, do I have eligibility at age 65? Not typically, not unless there's some special circumstance that we might have to dig deeper into. But if I just moved here, the way the rules are laid out is we have to have 5 consecutive years of U.S. legal residency prior to applying for Medicare. So what is Medicare? What are the main parts? Here they are. Again, if you are an agent that's been around for a year or two or more, this is going to be very familiar to you. If you are a newer agent, you should be starting to learn this and piece this together. And this is something that you want to be incredibly familiar with. So we're going to get into the nuts and bolts of these pieces today, especially the first two. But we have 4 main parts to Medicare: Part A, B, C, and D. Part A is hospital insurance. Part B is medical insurance. Part C is Medicare Advantage plans. And Part D is prescription drug coverage. Those are the 4 basic parts of Medicare. And I'm going to pause here for a minute because to me, this is another area of confusion. We have this whole letter system, A, B, C, D. We're breaking it into parts. So we're adding complication to the model right out of the gate. Right now, people are mixing these things up in their mind when they come to talk to you, or they try to talk to a neighbor, or they listen to something online and you sit down and meet with them and they have it all mixed up. And it doesn't make it any better that when we start to talk about Medicare supplement plans in future trainings, that Medicare supplement plans also have a standardized naming convention system from the federal government that also uses letters. Why not, right? So we have all these pieces and parts that have letters, and in every situation here, except for Part D, the letter has no correlation to the actual coverage, right? Part D makes sense, D for drugs. Part A doesn't really relate to hospital insurance in a meaningful way, or Part B doesn't really relate to medical insurance in a meaningful way, at least from the way that it's named. And what I really love about this is Medicare Advantage plans, most of them, Medicare Advantage prescription drug plans, are the sum inclusion of the benefits of Part A, B, and D. So only in the eyes of our government could A plus B plus D equal C, but that's the formula that we have here to work with. So let's get into some specifics about Medicare Part A, which we just said a moment ago is hospital insurance. Really important piece. We all have to be covered in case we have to go to the hospital. It's one of the most expensive things we can experience as individuals. And so this is what Medicare Part A covers generally. This is not a comprehensive slide here, but it's going to give you the main points. If you look at point number 1 here, there is not a premium for Medicare Part A. Again, if you or your spouse worked and paid those Social Security taxes for at least 40 quarters or 10 years. And in the next slide or two, we'll get into what a Medicare premium for Part A might look like if you don't meet that qualifying standard. But basically, we're looking at covering your hospital stay. Look at point 2 on the screen. And for 2026, if you go into the hospital, you have a deductible per benefit period of $1,736. We're going to dive deeper into what that means in the slides that are going to follow here. But let's just pause to recognize that this is a really confusing aspect of Medicare. Most of us think deductible, we think annual. Every insurance policy we've ever had in our entire lives has, for the most part, had an annual deductible. Only here with Medicare Part A could we have a deductible that is per benefit period, which is every 60 days. So that benefit period resets after 60 days. And that can mean that deductible, that $1,736, I could potentially pay that multiple times in a calendar year if all I have is Medicare Part A and I have multiple hospitalization. Now, let's say I'm admitted to the hospital and I have a stay that is longer than 60 days. So I'm in the hospital for 88 days. If all I have is Medicare Part A, after the first 60 days, which that deductible covers that $1,736. At day 61, I'm going to pay $434 per day as a copay up to day 90. Now, God forbid my hospital stay lasts more than 90 days. I now have to start tapping into my lifetime reserve days. There's a maximum of 60 that I can use in my entire life once I'm on Medicare. And those are going to cost me $868 per day here in 2026. Those copays and that deductible applies specifically to the confinement cost associated with the hospital stay. We're not talking about the physician's bills, the lab, the blood work, the imaging. We're talking about basically room and board at the hospital. Simple enough. That's what Part A is providing me. Another element of Part A that we like to talk about because it's kind of important here is skilled nursing. If you look at point number 3 on the slide, for skilled nursing, Medicare is going to pay all eligible expenses, keyword eligible, for the first 20 days. And then after that, there's a copay of $217 per day from days 21 through 100 of each benefit period. Members pay all costs each day after day 100 of the benefit period. And so this is really important. Medicare technically does not cover long-term care in a nursing home. When we talk about skilled nursing here, what we're really talking about is I'm in the hospital for an inpatient stay, 3 or more days, and then they have me go to a skilled nursing facility or a rehabilitation facility to continue to get better. That's what Medicare is looking to cover here with Part A, not your long-term care as an inpatient in a long-term care nursing facility. And so we don't want to give our clients a false sense of hope that Medicare Part A covers the nursing home, that it covers skilled nursing, because it really doesn't. This is post-hospital care in a skilled nursing facility, right? And like I said, 3 or more days of inpatient typically in a hospital before Medicare is going to cover. One of the most important lines, if not the most important line on our screen right now, is at the very bottom where it says there is no out-of-pocket maximum limit. This is another gigantic change for people coming off of employer plans. All of these costs, if all I have is Part A, and you are going to get a client that tells you, I just want original Medicare Part A and Part B. I don't want an Advantage plan. I don't want a Medicare supplement plan. On Part A for the hospital, they have unlimited liability. They can pay these copays and cost and deductibles to infinity because there's no out-of-pocket maximum limit. That's something that we're obligated to tell them and make sure they understand when they're telling us that they don't want additional coverage. So let's dive in now. I know I touched on some of these points, but I want to drive these home because even for our very experienced agents, we get asked these questions routinely. So some Part A specifics. What if I don't qualify for that premium-free Part A, meaning me or my spouse did not pay into Social Security for 40 quarters? So you may be able to buy it. In 2026, the premium is either $311 or $565 per month, depending on how long you or your spouse worked and paid Medicare taxes. In order to get this, you also have to sign up for Part B. And if you don't buy Part A when you're first eligible for Medicare, usually when you turn 65, you might pay a penalty. So for the Part A late enrollment penalty, when some people have to buy Part A because they don't qualify for that premium-free Part A, if they don't sign up when they're initially eligible for Medicare, when they're first eligible for Medicare, that monthly premium may go up 10%, and you'll have to pay the penalty for twice the number of years you didn't sign up. So it could be very, very costly here. And that's something that, again, we don't run into all the time, but it's a nice bit of information to have. So let's get into the benefit period here. A benefit period begins the day, this is specific to Part A again, you're admitted as an inpatient in a hospital or skilled nursing facility. So the benefit period begins the day you're admitted as an inpatient in a hospital or skilled nursing facility. And as we said previously, we're looking at 60 consecutive days for that benefit period. The benefit period ends when you haven't gotten any inpatient and hospital care for 60 days in a row, or up to 100 days of skilled care in a skilled nursing facility. So we're looking at a 60-day benefit period. All right. And so this is really, really important. Again, we can end up paying this multiple times in a year, depending on how our health situation goes. If you go into a hospital or a skilled nursing facility after one benefit period has ended, a new benefit period begins. At that point, you have to pay that deductible once again. And there's no limit to the number of benefit periods in the rules. There is, however, a calendar limit, right? I can only have so many 60-day benefit periods in a calendar year. And it's very unlikely that I would have every single one of those line up perfectly where I would max out, these benefit periods. But we have seen clients that only had Part A have 2, occasionally 3 benefit period deductibles because they didn't want to pick up additional insurance. So that's really important, right? We want to make sure that they understand this. Let's talk about lifetime reserve days. So in original Medicare, these are additional days that Medicare will pay for when you're in the hospital for more than 90 days. You have a total of 60 reserve days that can be used during your lifetime. For each lifetime reserve day, Medicare pays all covered costs except for that daily coinsurance amount that we went over. Each day after you use all of your lifetime reserve days, you will pay all costs. So this is very similar if you work in an employer setting where they have a sick leave bank and you have a maximum number of days that you can draw from. This 60 days is for the rest of my life once I'm on Medicare. So anytime I get above 90 days in the hospital, I'm tapping into that bank. And again, this is very, very rare to encounter clients that run across this, but you do need to know it in case it does happen. Okay, we're going to shift away from Part A into Part B. This does have the 2026 information on it. Part B is our medical insurance. It's going to be that routine care that we get from medical professionals, doctors, specialists, our lab work, physical therapy, occupational therapy, surgical costs, and many, many other things. Some equipment and, importantly, some medications are covered under Medicare Part B. Part B premiums are income driven. We're going to get into that in a moment, but the standard premium for 2026 is $202.90 per month for most people. There is, again, a premium penalty assessed here for late enrollment without a qualifying special enrollment period. We'll get into that a little more deeply in a few moments. Point number 2, there is a deductible. Unlike the Medicare Part A inpatient deductible, the Part B deductible is annual, which is what we're more familiar with as insureds. We have a one-time deductible of $283 per year for 2026. That number and most of these numbers we've been talking about here do change annually. Other costs. You must pay 20% of the Medicare approved amounts for qualifying medical services plus excess charges if applicable. So if all I have is Medicare Part B without a Medicare supplement plan, I'm paying 3 things. Number 1, my premium. Number 2, the deductible, which is I pay first. So my first office visit, I'm paying that $283, or I'm going to pay $160, and then at my next appointment, I'm going to pay more until I hit that $283 for the year. I'm going to pay 20% of everything else that's covered under Part B. Some really important words on this slide. under point 3, Medicare approved amounts. There are specific amounts that Medicare approves for services. In some states, providers are permitted to charge more than Medicare approved amounts, which can lead to you having excess charges. We're going to talk about that more in a minute. But whenever you talk about Medicare coverage, always use words like Medicare approved, right? Qualifying coverage. You don't want to talk about things in absolute terms. You see here it says qualifying medical services under Part 3. That's what we want to say when we're describing these benefits to beneficiaries. We're looking at Medicare approved amounts in terms of these 20% costs, and we're talking about qualified medical services. Really important. So that's 20% of these qualifying medical services that are going to be our burden if all we have is Part B. And just like Part A, that blue sentence on the bottom right of the screen, no out-of-pocket maximum limit. So I'm paying 20% of all qualifying medical service costs to infinity if all I have is Medicare Part B. Imagine having a massive cancer treatment program and what that cost, and you as the beneficiary having to pay 20% of the cost for that. That's not something that we want to leave our clients vulnerable to face. So we said that Medicare Part B premiums have an income-driven component. I'm certainly not going to go over this slide line by line. This is the 2026 Medicare Part B and D premiums by income. It's based on your filing status and yearly income in 2024. It's a 2-year look back. And what they're really looking at here is modified adjusted gross income. That's Form 1040, line 11, plus the tax exempt interest, line 2A, on your 1040. So as you can see here in the columns to the right, the higher my taxable income, the higher my Part B premium. And then my Part D, so my drug plan, also will get a premium add-on. So that premium for Part D there that you see, the $1,450 plus your plan premium, those amounts are paid to the insurance carrier where you get your prescription coverage. Where that second column over from the left that says monthly Part B premium plus IRMA, income-related monthly adjustment amount, those are paid to Social Security along with your Part B premium. So at the very, very bottom line here, if I'm an individual tax return and I file for $500,000 and above modified adjusted gross income, my Part B premium that either comes out of my Social Security, or if I don't have Social Security yet, I have to pay it quarterly to the government, is the standard $202.90 plus $487 for a Part B total of $689.90. And then whatever prescription coverage I get, I'm going to pay an additional $91 a month. It could be very costly. So this slide to me in the entire presentation today is the most important. Never, ever have a meeting with a client who's new to Medicare or otherwise where you don't talk about this. And don't assume just because they were your client last year and they didn't have one of these income-related monthly adjustments that they might not have it next year, because if they take taxable distributions from investment accounts, if they win the lottery, if they sell a property and have taxable income, or like where our office is located, we have a lot of clients that were farmers that for more than 2 decades reported $25,000 of taxable income. Then they became millionaires overnight for oil and gas rights. Their income can change. And then they're going to be calling you saying, Dave, why didn't you tell me that I was going to have a $689.90 per month Part B premium? It is on us to make sure that they don't call us back mad because we didn't go over this with them, and make sure that they really understand it. We'll talk more about a resource for this for you at the end of the presentation. So let's talk about the Part B late enrollment penalty. You will very rarely ever have a client come to you fearful about a Part A late enrollment penalty because, as I said previously, it's very obscure and people don't talk about it that much because of it. But they all will come to you, not all, but many, fearful of a Part B or Part D late enrollment penalty. And generally speaking, your client will not have to pay a Part B penalty if they qualify for a special enrollment period or if they sign up for Part B at age 65 when they're eligible. If they miss their initial enrollment period or they come to you 5 years after turning 65 without a special enrollment period, like leaving employer coverage, right? They could have to pay an extra 10% for each year that they could have signed up for Part B but didn't. 10% for each year. Now, they might also get a higher premium depending on their income, like we just talked about a moment ago. Please do not become a late enrollment penalty calculator or advisor. If someone comes to you and you know they're going to have a Part A or Part B late enrollment penalty, direct them to their Social Security office in their county for an advisement session to find out what that's going to be. We as independent insurance agents should not be trying to figure that out for them because we don't have all the information. And one thing you'll learn quickly in this is a lot of what people tell you is inaccurate. So we don't want to give them a number that's too low. Definitely not that, but we also don't want to give them a number that's too high. Let Social Security tell them what their late enrollment penalty is going to be. We can just make sure to be heads up about it and point our clients in that direction when it becomes a need. Excess charges. The amount a doctor or other healthcare provider is legally permitted to charge can be higher than the Medicare approved amount. And that means I have to pay for that, right? Medicare is not going to pay for those charges above the Medicare approved amount. This matters a lot in our client meetings. When we're looking at accompanying plans to go alongside original Medicare, like Medicare supplement plans, there are some supplement plans that cover excess charges. Actually, now there's only one for most people, and the most do not cover excess charges. Depending on what state you're in, this can matter more or less because state rules also can put in place provisions that stop excess charges from being an issue. But it helps us advise people on plans. It helps us delineate the difference between Medicare Supplement G and the others. Or F, if for some reason there's somebody that you meet with who's still eligible for that. Knowing this is important. It's not something that a lot of people encounter in the state that I live in. But in some states, it's a huge deal. The last thing you want is someone getting blindsided by a bill for excess charges with no coverage for it in a state that allows it. Just like that IRMA piece, knowing this is what distinguishes us from agents that don't really do this all the time and don't really go the extra mile to care about their clients in a meaningful way. So just a few more notes about Part B coverage. Medicare Part B medical insurance, right, covers a limited number of outpatient prescription drugs under certain conditions. Typically, Part B covers drugs you wouldn't give yourself. If you're going to get those drugs administered at a doctor's office or in a clinical outpatient setting. Things like chemotherapy, things like dialysis, things like all these new modern immunotherapies like IV Humira for people that have Crohn's and colitis. Those medications are covered under Medicare Part B. There's a whole lot more, and I put a link in this presentation, which I will share out with the group that attended today. Go to Medicare.gov, look up Part B covered medications to see the list. This is hugely important because if somebody's new to Medicare and they're on a Part B medication, right, it's covered by Medicare Part B, and I put them on a Medicare Advantage plan, they're going to pay 20% of the cost of those Part B medications, which can be extremely costly all the way up until I meet my maximum out-of-pocket amount. If they're on a Part B medication that's costly and I put them on Plan G, the Medicare Supplement Plan G, they're going to pay the Part B deductible, and then that supplement plan is going to pick up the cost of that 20% for them. So this is a huge part. When we get into the sales trainings that we have coming up, we're going to go over how important understanding these Part B medications really is in our industry today. I personally think it's one of the biggest and most egregious errors that we can make in a meeting with a client is to not really get this piece and to understand the different coverages and how they help that client afford those important medications. So again, lifetime reserve days, that's a repeat. We already went over that. But just for that review, 60 days, most I can use in my lifetime, above day 90. And that is that bank that we can pull from one time ever. Let's talk about applying. So there's a couple ways that I can get original Medicare, and you really need to know all of these ways as an agent really, really, really well. So the first is automatic enrollment. So if your client is already getting benefits from Social Security or the Railroad Retirement Board 4 months prior to turning 65, they automatically get Part A coverage, right? If they're getting those Social Security monthly benefits, those retirement benefits, it used to be checks. Now it's direct deposit. 4 months before turning 65, they're automatically going to get enrolled. They will also get signed up for Part B unless they live in Puerto Rico or outside the U.S. Now, this is important. Because you pay a monthly premium for Part B coverage, you can choose whether to keep it or not. So you might have a client who tells you, I'm going to work past age 65. I don't want Part B. I don't want to pay the Part B premium. But they're already getting their Social Security benefits 4 months before they turn 65. So they're automatically enrolled in Part A and Part B. They're going to get a card in the mail. How do you advise them? When they get that card, there's going to be information in there on what to do if they want to defer Part B. They send that form back in, and they don't have to take Part B if they don't want it at that point in time. Okay? But they will, again, they're getting those Social Security benefits 4 months before they turn 65. They will be enrolled in both A and B upon their 65th birthday, the first of that month, right? So how do we actively apply? Increasingly, if you look on Medicare.gov or the Social Security website for how to apply for Medicare, they're pushing people hard towards the online. It's the easiest and fastest way to sign up and get any financial help you may need. You have to create your Social Security account to sign up for Medicare and apply for benefits. Or if you work for the railroad, you have to call them, and that number is here on the screen for you. So the online application. Okay. The online application for Social Security is not difficult. The difficult part is, did your client already try to create an account for my Social Security? If they already have an account and they don't know their password, and you try to go down that road of helping them, it could take hours. Password resets and the whole 9 yards. If they know how to log in, it is a very, very easy application. On their home screen on Social Security, at the very bottom, there's a piece for health benefits. You click apply for benefits, and you fill out an application that takes much less time than applying for a Medicare supplement plan. The one caveat is you want to be careful because there is an option to apply for two things at once when you're doing your Medicare application. You can actively apply for Medicare A and B and Social Security retirement benefits. If you're helping a client do this, you want to be very careful to make sure that if they do not want their Social Security retirement benefits yet, which might be the case, some people hold off on getting that because they want to allow their monthly benefit to become bigger over time. There's a little bubble that you check on the application that says apply for health benefits only. And you don't want to miss that, okay? The other thing I don't really love about the original Medicare applications is there is no effective date option. So if for some reason you're helping someone apply who has a special enrollment period, whether you're using a paper application or the online application, in the notes section, boldly and largely indicate when you want Part A and B to be effective for that individual. If you're applying for someone turning 65, helping them do that, and they're going to pick up A and B the first of their birth month when they turn 65, no problem. That's when it will become effective. But if it's after age 65, that's where I sure wish on that application, both paper and digital, there would be an effective date choice. And as of right now, there is not. So we can also actively apply by phone. We can call the Social Security Administration's toll-free number at 800-772-1213. And we can schedule an appointment with them to do that application over the phone. Some, not all, local Social Security offices will let you come in and have an appointment and do that in person. Ever since COVID, that's been a little hit or miss from what I hear across the country from the agents that we work with. So if you are applying for Part A only, actively applying, you're going to follow the same process as outlined for applying for regional Medicare, but there's a bubble on the application where you can suggest that you're only going to take Part A for the time being. Very, very easy. Part B, this is the most involved application process that there is. So if I took Part A at age 65 and I kept working and I had an employer plan and now I'm 68 and I'm ready to retire, applying for Part B only has a couple extra steps. And so under that situation that I just outlined, I was covered by an active employer, as you see on the screen. Since I turned 65, that's going to end. So within the last 8 months, that policy is going to end. I can enroll in Part B coverage without any late enrollment penalty because it's a special enrollment period. To do so, there are 2 required forms that I have to complete and submit to the Social Security office. One is an application for Part B. The second is called a request for employment information. And what that form is intended to do is verify that you had employment and coverage, thereby justifying the special enrollment period. From what I have seen, I don't love the online version for this because it still makes you print out a paper and upload a paper later. The easiest way is to have the individual fill out the 2 PDFs. They take one to their employer, and then they can take and mail those to their local Social Security office. Sometimes we'll have them bring them back to us and we'll fax them. Sometimes we'll give them an envelope already with the address of their local Social Security office. I can tell you I put Post-its in those little signature flags everywhere on these 2 paper applications. And we do have a previous training in our web recorded series on how all of this works. We'll probably be doing a new one later this spring. But this gets a little complicated for Part B only. 2 forms, one the individual fills out, one the agent fills out. And this is what I was talking about a few moments ago. We are now in a special enrollment period scenario That application for enrollment in Medicare Part B will not, at least it doesn't, the day I'm making this recording, does not have an effective date, bubble, or option. We want to indicate that in the notes section every time. I'm applying for Part B, and I want that to go into effect March 1st of 2026. So we're winding down here. If you are a TLC affiliate or agent or agency, and you're watching this today, and you already have access to Agent Hub, you're going to have access to the recorded version of this, along with a new PDF version of the presentation, and then a 2-page guide on Part A and B coverage in IRMA with those costs. TLC has that now. If you're already an agent and you want a customized version of a 2-page Part A and B coverage guide with your 2026 cost, you can email marketing@tlcinsurancegroup.com to have that customized for you. We're working on getting those new 2026 forms uploaded to Agent Hub. And then there will be PDF versions of the 2 forms needed to apply for Part B and a little guide that we have for you. Those should also be available for you on TLC Agent Hub. Those of you that were in attendance live today, I'm going to go ahead and send those to you at some point. I'll download the list from our attendees today, and we'll send those resources over to you so you have a copy to help you. Additional resources, as always, I talk about it in every training. Medicare.gov is by far the most accurate and trusted source for information for us as agents. You should always download and have on hand the Medicare and You guide. It's a great reference piece that clients get in the mail. I like to use it for that reason. They see me using what they got from the government. And then, of course, there's learning module content from AHIP and NABIP and our carrier certification sites. Also give us a lot of the credible information content that you saw here today. Thanks so much for joining us for the training today. If you're watching this in the recorded version online and you have questions, don't hesitate to reach out to us. If you're not already a TLC affiliate agent, we'd love to talk to you about joining our team.